But I do want to share one story of mine that just goes to show like how intense this can be. So, and this is not to trigger anyone. It's merely to show kind of like how intense this is. So when I'd given birth to my daughter, and my daughter was like maybe like a month old or something like this. No, I'm lying. She was about a week old. I was doing a bit of Googling, I don't know why, and I came across like blood clots in the leg, right? And I was like reading, and it was like, oh, women who have like spent a long time in hospital, which I had. And I was like, oh yeah, they did put compression stockings on me, whatever. So as I started to read the symptoms of a blood clot, which was just, generic swelling, redness, whatever, I started to panic, and I could feel my nervous system switch on. And I was like, oh gosh, like, yeah, I was in hospital for 4 days and I didn't move. Like, I didn't leave my bed. Like, what if I've got a blood clot, and what if it travels and blah, blah, blah. And lo and behold, within probably 2 hours, my right leg had become really hot in the calf, red, swollen, to the point where I called an ambulance. So I called 999. The paramedics came, and he like felt my leg, and he was like, yeah, he was like, your right leg is a lot hotter than your left. He was like, it's red as well. He measured it with the tape measure and confirmed that it was in fact swollen. So that to me was confirmation. I was like, shit, I've got blood clot. And I got taken in the ambulance, and they were like, look, we're gonna take you in, because you're very anxious, and we want to get this sorted for you, sort of thing. We'll do an ultrasound on your leg and whatever. So I got taken in. I had the ultrasound done. Nothing there, right? Nothing there. And I was like, well, there must be, like, check again. Like, I was like, look at my leg. He was like, no, nothing there. And honestly, within 15 minutes, my leg went back to normal. And that for me was the first moment in my life I was like, did I just fucking do that? Like, did I really just do that? Like, because I literally read the symptoms, and my body made my legs swell, and that to me was both terrifying but fascinating at the same time, that I could literally manifest. And I don't mean manifest in like the law of attraction kind of thing. I mean, my mind body connection literally gave me the symptoms, and it was really eye opening to me, because then it was like, hang on a minute, what is anxiety, what is mind body, what's somatic, what's real, what's not. And that was confusing. And I know, Joseph, you'll know that feeling too. You're kind of like, is this a mind body thing, is this a real thing, like, do I need to pay attention to this? And that can be really hard to navigate, can't it?
Yeah, it's so annoying. So annoying. I'm kind of like somewhat of a I'm somewhat of a master, so it's like I can tell. Now there is still rare mind body symptoms, so rare to the point where like I've experienced the symptoms so rare where like I even Dr. Dan Radner, the psychologist that I've talked about earlier, like he has been in clinical practice for like decades and he had never seen the symptom before. So there is still rare symptoms, but it was still mind body. So now I'm so aware, and I talk to so many people who deal with this that like I'm pretty dang on point with like, okay, this is just mind body. But then sometimes I'm not sure, and that's when it's super annoying. That's where having like a coach, a mentor, a therapist who's like worked with a lot of people clinically with this kind of stuff, or a doctor who's aware of the mind body connection can be like really valuable. Um, the unfortunate reality is that like there's just not enough practitioners in general, like coaches, doctors. You did say something earlier that I really enjoyed was that when you talked about manifesting, uh, a lot of people when they come to this information, it can kind of feel like, oh, I did this to myself type of deal. Like, no, you didn't. Trust me. Like, let's say even you were like Cherelle and you were like worried about a disease, right? And you created the symptom like in a very direct way. The reality is that like there's also a whole bunch of people that also got symptoms that they never even thought about ever. So like in Cherelle's case, Cherelle, if your body like needs to create a symptom, it's gonna do it. Like The difference is that Cherelle kind of like helped her mind out and just gave it like an easy one to go to. But the reality is, let's say she wasn't worried about a disease process at all. If her mind felt the need to create a symptom, it would have done it, and it would have done it. And but what happens is that the mind always chooses the path of least resistance. And so remember, we said if it's trying to get your attention, it's usually going to go somewhere. The pain is going to be created in a spot that's going to get your attention. Number one, easiest way for your mind to get your attention is to pick something it knows you're already afraid of. So in Cherelle's case, that was easy. Like, okay, she's worried about blood clot. Like, damn, easy way to get her attention. It gets a little more creative when, for people without health anxiety, for example, it's known that it goes to old injury spots. So you might have like tore your ACL like 4 years ago, and then boom, your mind's gonna put pain right on that spot where the ACL is. And this is where like it's so crazy how the mind is so intelligent all on its own without any conscious direction, that it will do that. So we'll go to old injuries. I've also seen people with old real people that had real illness, like a real physical illness in the past. The mind will go to that spot. If somebody's had like a stroke in the past, it might give somebody stroke symptoms, but they're not actually having a stroke. It gets really creative if it needs to get your attention. So yeah, if you're on here, don't feel like you did this to yourself. You didn't. Like, the mind just does this all by itself. So it's not you. I hope that makes sense.
I love that, because it does that whole idea of like somaticizing almost to like a specific area, especially when there's been like a past trauma. Like, the amount of clients that I have, honestly, that will join and we'll get chatting, and they'll say to me like, yeah, at the moment I have like really bad cardiophobia. In fact, this happened with I'm obviously not going to name names, but one of my clients the other day joined, and really, really bad cardiophobia. And what it was is that like a year before, his friend unfortunately passed away from a cardiac arrest. I know this is trigger into here, but whatever. And so he somaticized his symptoms to his heart. So like that kind of, it can be that it's other people too, or like I have like this other client, and he watched somebody pass away of a certain illness, and then he had the same symptoms of that illness. It's just, it does get creative, and it's very it's very difficult for health anxiety sufferers and non-health anxiety sufferers to be able to step back and to see that, because in the moment the brain has done what it wants you to do. It's caused a panic, it's got your attention, and when you follow that train of thought, then, well, it can lead you to some dark places, let me tell you, because I've been down them. It's kind of like, it starts off with like, a person getting headaches. Why am I getting headaches? Oh my gosh, I'm getting really bad headaches. And then Googling that, I've got a brain tumor now. And let me read the symptoms of a brain tumor. Oh shit, dizziness. Now I'm getting dizzy. And it's just, that is how it happens. And that is why somebody will say, I've got every single symptom of this disease. And the person with health anxiety is screaming at the doctor like, but I have every symptom. The doctor's like, you're fine, but I've done that. And it's really difficult to be in a place where you're ticking off everything thinking this must be true, when it was all in the mind. Like, honestly, I have some mad stories, like, and it's just,